Hi, Bridget. How are you?
I'm doing great. How are you?
Good. Thank you for coming and speaking with New Beauty about your Sofwave treatment. And I know a lot of our readers and followers have a lot of questions about Sofwave. So I'd love for you to tell us about your experience. What was bothering you before you had your Sofwave treatment that brought you to see your doctor?
The thing that I noticed on myself was loose skin, just right around the jawline, the neckline, and everything like that. And I really wanted that lifted look. And so had a consultation with them, and they said I looked like I would be a great candidate to go in and have this treatment done.
Now, you're in your 30s, right? Have you tried other treatments for this lower face area?
No, I haven't. This is the first thing I've tried for that. I've done Botox and stuff, fillers in my cheeks and my lips, but I've never tried anything down here. So this is my first treatment for that.
What made you decide that Sofwave was the treatment that you were going to try?
They really, you know, talked to me about it and made sure that I was comfortable with what everything that was going to be happening. And I looked at a lot of before and after photos and I saw like great results. And so I knew that I wanted to go ahead with that treatment.
So you tell me exactly where you had it and what did it feel like? How long did it take? What what was the experience like?
Well, I had it done all over from my neck all the way to my full face, actually. I went ahead and did the whole thing. I was like, we're going to go in, let's do the whole thing. And they made sure that I was comfortable throughout the whole process. I went in and I had numbing cream put on for about an hour beforehand to make sure I was really numb before we went ahead with the procedure and everything. And it was wonderful. They made sure that I was comfortable as I could be throughout the whole procedure. It was a little uncomfortable, but it wasn't something that you can't handle or anything like that. It's not something that you would be like, oh God, I'm never doing this again.
When you say it was uncomfortable, was it painful or was it just tingling? Like what
It
can
was,
people expect?
it was like, it just kind of like heated up is what I felt whenever I had the procedure done. It was like it got warm and then it got hot. And then as soon as it got hot, it went away. So it was a very quick, uncomfortable feeling, not necessarily painful feeling.
And did you have any redness, soreness the next day? Did it stop you from doing anything you would normally do?
I actually went back to my normal everyday life. No one noticed that I had anything done after I had it done.
When did you do it?
It was about 6.5 weeks ago.
So can you already see results that you noticed?
I definitely can see results from the before and after pictures that we took. I can see results in my lower neck area. It's all lifted and it just looks so great.
And what kind of results? You're saying it looks lifted. Do you feel like a more tightness, more definition?
Oh, yes, definitely. I definitely see like my jawline better. Just everything looks so much better than it used to. It's like it brought back that little bit of youth that I like was missing in my life.
So you've done it once already. Are
Yeah.
you planning to do it again? And if so, how often?
We'll definitely plan on doing it again. I'll contact them and let them know that I'm interested in doing it again whenever that year kind of mark goes around, and I'm sure they'll let me know if I'm about at that time frame when I should come back in and do it again.
So do you foresee this as a every year, let me keep doing it to maintain the results?
I definitely look for something like that. Yeah.
Yeah. And you've never had any type of energy treatment like this before.
No, not my facial area or neck area like that at all.
And then how about your neck? Because I know a lot of people, this area right here is like really bothersome, especially when it starts to get crinkly in our late 30s and 40s. What did you notice here?
I noticed that it definitely softened everything up. It just looks a lot tighter, like a lot more lifted. It's smoother. Um, I just love the results.
Yeah, you look great.
Thank you.
You look wonderful. And I think for a once a year treatment, it's totally doable, right?
Yes, definitely is.
Yeah. Well, thank you so much for sharing your story with us. We love to hear about all of the different treatments available out there. And Sofwave is one that a lot of people are interested in, especially in the areas that you noted.
Thank you for having me.
Wonderful. Thank you so much, Bridget.
Thank you.
Hi, Dr. Franco. Thank you for joining New Beauty today.
No, thanks for having me. Super excited to talk all about Sofwave today.
I should mention, because I spoke with Bridget a second ago, that you are a plastic surgeon in Austin, Texas. And thank you so much for enlightening us on Sofwave. What is Sofwave? How does it work? And how does this energy treatment help tighten our skin?
Yeah, I think it's super interesting. So Sofwave is unique in that it uses something that we call parallel beam ultrasound, but basically it's very targeted ultrasound energy at a very specific layer of the dermis. And there's been other ultrasound technology in the past, but not as targeted to the dermis. And that's what's super unique about it. The other thing that's really unique and the world's biggest baby is basically how comfortable the procedure is. And so they've been able to innovate and because it's almost the hard part of how do you create energy without creating heat. And so they have a cooling and energy based a device that's very super precise. So that's what causes the collagen stimulation in that dermal area that leads to the lifting of the soft wave. And really cool because and I can't even keep up with the amount of FDA indications they have, but everything from arms to butt and of course lifting that face. So that's what's really cool with the minimal downtime.
Bridget mentioned she said her whole face, but where do you typically apply Sofwave? Where do people typically have it done on the face?
It's that's a good question. We'll get into a little bit of our practice, what I think is a little bit unique, because I think we're one of the rare practices that does as much body energy treatments as we do facial. I think some of the weight loss journeys and this ozempification of aesthetics has really changed a lot of that. She came in for probably the most common reasons, and people talk about their face, but a lot of times when people talk about their face, they're talking about kind of their mid face, and even the neck kind of rolls into this. And a lot of times people just like, I just want to look a little bit more rejuvenated, a little bit, tighter, especially with this whole concept. And you've covered this filler fatigue. And so, people who are living their fit and fabulous journey, they want to look refreshed and young, but not overly filled. And that's where I think Sofwave has really come in clutch for them.
Well, I'm hearing a lot from patients who are successful with weight loss or even just aging at this age in our 30s and our 40s, that this area of the neck right here is a huge concern for a lot of people. And Bridget mentioned that she was treated here as well. Do you recommend Sofwave for crepey skin in the neck?
100%. I think the neck is probably one of the biggest areas because, especially in our weight loss, I think this is one of the areas that we noticed it the fastest. One of her big goals was to enhance her overall jawline. And so, sometimes creating that jawline is by tightening that because you don't want to overfill or over masculinize them. And so the idea of tightening and structuring that I think is absolutely key with some of that. The other thing that's super interesting is that, a lot of times I think we used to think of soft wave or other energy devices for more of our more mature patients, but now with the weight loss, we actually see a lot of really young patients with issues that we typically associate with more mature patients. The one thing that's been interesting for us is because they're younger, I think their dermis is a little bit thicker. They probably still have a little bit more elastin and collagen. They have been so much more responsive to these energy devices, which kind of makes sense if you think about it, right? They got more of an area to target. Their skin still has a little bit, just needs a little help getting back.
Keep hearing too from different experts and doctors that you shouldn't really wait till you've hit your weight loss goal to start treating the areas of concern where you do have lax or, skin. Is that the same philosophy that you recommend to your
Uh,
patients?
100%. You and I have talked about it in the past. I've lost about 90 pounds on the GLP journey. And if I could change one thing, I wish I had started earlier. I probably waited till I was about 6 months into my journey. It lost probably about 65, 70% of that weight. If I could have started, by the second or third month, I think I would have gotten to my goal a lot faster. And for a lot of our patients, we're just trying to hold the line. We're trying to build that collagen from the get-go. It's much easier to be proactive than trying to fix something later. So 100%, I think the sooner you can get started, the better, especially with things like this that have very little downtime, very little downside.
Right. Absolutely. And it's so interesting right now. We're in a whole new world and people are looking for solutions. How many soft wave treatments do you recommend someone undergo if they're trying it for the first time? Is it one or do some patients need a little bit extra?
I think most people, depending on when you're starting, are going to need extra. And so a lot of people will start with one, depending on where you're at. Also tell people if you're doing this at the beginning of your weight loss journey, as long as you're continuing to lose weight, you're likely still going to need treatments. And then, unfortunately, it'll help tighten, but it doesn't stop the clocks, the hands of time. And so you're going to continue to mature with time, better than the alternative. And so, hopefully, you're still being proactive about that. So we have a lot of patients that will come in once a year, once every 18 months, just to try and stay in a great spot. And I think people who are proactive about this, stay in a nice steady space and rather than trying to do too much in one time.
And you mentioned before that it's great for other areas of the body. And I know it's been FDA approved for cellulite too. So, and also, what about like the stomach? If you're, we have, that's one area where we have a lot of loose skin. If you've lost weight, would you recommend it for someone who is having an issue in that area?
It's interesting. We do it a ton for the butt because, it's interesting. We as medical professionals have a definition of cellulite, but I'll tell you for our patients, cellulite to them typically means anything they don't like from their butt, legs, or thighs. And so, and in this world of GLP medications, it's usually a combination of true cellulite fibrous bands causing dimpling, but skin laxity, and then even some volume loss. And so this is where a lot of times we'll do combination treatments. We may do some targeted subcision with Sofwave to tighten that skin around it and improve the overall. I'll tell you the other thing that has been great is for Sofwave in areas that you're talking about for people that don't want surgery or surgeries are challenging. Arms is a huge one for us because not everybody wants the big incision along their arm, especially if you got just a little bit of that wrinkling. And I think in the
Yeah.
past, there were people we just kind of pushed away because like, hey, there's not a great treatment. And they may need more than one or two soft waves, but for them, they're like, I'd rather come in every 6 months, keep improving until I'm happy, than have a scar that I can't go back for on my arms. Same thing for around the knees and legs. I think those are areas that are surgically really hard to treat. And now we have a good alternative for them.
And who would be a really good candidate? So, if someone's considering Sofwave and they're not sure it's a fit for them, who would you recommend it for?
I think anyone starting their weight loss journey should at least think about it to be proactive. I think anyone that has just a little bit of mild to moderate skin laxity or loose skin in terms of things. I think when you start to cross a certain threshold, you really need to have a frank discussion with your provider to make sure that you're in this day and age, I think, people want to make sure that they're getting good value for their resources. And so making sure this is the best course for them. And this is where just having a really open discussion of where you're going with your weight, what your overall goals are and what you're open to. And I think that's helpful. I think the thing that people have loved most about Softwave for us is that, the little downtime. I think right now it's hard to be off work. Most of us are running and moving in terms of things. And so, the being able to do a treatment and be back to work that same day or the next day, I think has been a huge value add for our patients that it's just really hard to be out of the limelight for an extended period of time.
Absolutely. And I really like the part where it doesn't hurt, where it's
Mhm.
just a little bit of heat. And then again, you said for maintenance, a lot of your patients will come back in either a year or 18 months. So is that what you recommend? Is this a once a year type of treatment in order to maintain results?
It is if you're at a great spot. If you're still losing weight, then it's going to be more common. We've seen people do it as frequently as every 3 months if they're really on a weight loss journey. Also, too, if you're someone who's like, I'm trying to avoid an arm lift or, some things where you're actively, hey, we're going to need 2 or 3 treatments, then we'll definitely be more proactive of doing treatments in a sooner fashion. But once you get to a good spot and you're trying to maintain, then I would say every 12 to 18 months to hold that line.
Wonderful. Well, thank you so much for speaking with New Beauty about Softwave. I know a lot of people are very interested in this treatment, and I think this will help enlighten them and give them more info. So thank you
I
so much.
appreciate you having me. Always super fun to connect with you.
Thank you.